10th nerve. What about the 10th? You remember this is the longest cranial nerve, and this is the nerve with the widest distribution in the body. Widest distribution in the body. Yes. Vagus nerve. Vagus nerve is supplying the head neck region, thorax region, and also the abdomen region till the midgut and till the kidney and upper ureter. It will supply kidney, upper ureter, and it is till the midgut. What else it is supplying? Vagus nerve is actually supplying thorax, bradycardia, bronchoconstriction, if you remember. What else it is supplying? Larynx. Sensory supply, motor supply also. When I say it is supplying larynx, sensory supply, motor supply, fine. What else it is supplying? Actually, it is making a vagus accessory complex. Why do you need vagus accessory complex? It is vagus nerve and cranial part of accessory nerve to control the muscles of palate and pharynx and larynx. So you're telling palate, pharynx, larynx muscles are controlled by vagus nerve? Yes, along with cranial accessory nerve. That is called vagus accessory complex. So this is all what we have to discuss stepwise manner. Start with the vagus nerve giving you meningeal branch. Why the vagus nerve give meningeal branch? Because you have to supply dura mater in the floor of the posterior cranial fossa. So you have some dura mater in the posterior cranial fossa, yes, supplied by the meningeal branch of the vagus nerve, yes. Not only vagus, there are other branches also, but one of the nerves supplying the dura mater at the posterior cranial fossa is the vagus nerve. What else it is doing? You remember it will pass through the jugular foramen. What? The vagus nerve, yes. Then it is followed by cranial part of accessory nerve, vagus accessory complex, which you have to discuss separately also. So what is it doing then? It is supplying the external ear near the external auditory meatus. So this sensory supply, yes. What is the name of nerve? It is called as Alderman's nerve. You mean to say if I touch here, vagus nerve is activated? Yes. Near the external auditory meatus, yes. Alderman nerves, yes. Okay. What else it is doing? It is giving some pharyngeal branches so that it can supply muscles of palate, pharynx and larynx. What? It is giving some pharyngeal branches supplying the muscles of palate, pharynx and larynx. Palate, pharynx and larynx, but I thought larynx is having some other type of nerves. Yeah, they are called as superior laryngeal nerve and recurrent laryngeal nerve, also branches of vagus, which you can discuss separately. But it is also supplying carotid sinus. But carotid sinus was supplied by glossopharyngeal nerve. Yeah, it is also supplying carotid sinus. Then what else it is supplying? You know, constrictors of the pharynx, superior constrictor, middle constrictor, inferior constrictor of the pharynx to move the food down means deglutition. Yes, vagus nerve is helping by supplying superior constrictor, middle constrictor, inferior constrictor. And it is supplying the muscles of larynx by giving a recurrent laryngeal nerve and one muscle supplied by the superior laryngeal nerve. Actually, all that discussion is separate. We have to discuss separately. If you have to discuss all that separately, then what are we doing right now? Right now, it is just an overview. So what is this overview for? See, first of all, you have to understand vagus nerve is along with glossopharyngeal nerve coming from medulla. So glossopharyngeal and vagus both come from medulla? Yes, in fact, you have known in the medulla oblongata anteriorly we have pyramid on each side. Behind the pyramid you are having what is called as olive on each side. And behind the olive you are having the number 9, 10 and 11. Which 11? Cranial part of 11. So you are telling first you have pyramid, yes. Then you have some 12th nerve there, yes. After that you have olive, yes. And then you have the number 9, 10, 11, yes. Behind the olive, yes, posterior lateral to olive. So posterior lateral to olive you have number 9, 10, 11. From the medulla oblongata, yes, this is 10th nerve. Now 10th nerve, as we are suggesting, supplying superior constrictor, middle constrictor, inferior constrictor. It is also supplying the muscles of the larynx, pharynx and palate also. And what else it is doing? Vagus nerve is supposed to supply constrictors and laryngeal muscles, and it is sensory to the posterior most tongue. You remember? Taste and general sensation, posterior most tongue, fourth arch. So it is sensory not only to the tongue, it is epiglottis also, tongue and epiglottis, fourth arch, and pharynx, larynx. Larynx, there is a vocal cord. Above the vocal cord, there is another branch of vagus, and below the vocal cord, there is another branch of vagus. And what is those branches? Separately, we'll discuss larynx, then we'll discuss. So what are you doing right now? Supplying thorax, bradycardia, bronchoconstriction, and supplying abdomen till the midgut, till the kidney upper ureter, and also reaching pelvic cavity. Pelvic cavity, vagus nerve reach pelvic cavity. How? Ovaries, testes, gonads, yes, they are supplied by vagus nerve. Ovaries in the pelvis, yes. Testes in the scrotum, yes. Supplied by vagus nerve, yes. Okay. So pelvic viscera also, yes. Okay, fine. Then what about the other things? Actually, this is also talking about some lesion. So what lesion is there? Right-sided hemianesthesia. If the right nerve is gone. Right-sided hemianesthesia means where? In the tongue, in the epiglottis, in the larynx, in the pharynx. And what else? See, pharynx, larynx, tongue will have problem. Even external auditory canal. Why? Because not only the external auricle is supplied by canal, deeper inside, is also supplied by vagus nerve. So sensory loss in the canal also. Yes, partly. And what else? If it is right vagus nerve injured, right palate muscles are gone. So remember this thing. Uvula is palate. If the right vagus is gone, uvula will deviate to left side, opposite to the side of lesion. Why it will deviate to the opposite side of lesion? Because of the muscles, some muscles becoming more powerful, others becoming weak. So uvula is now deviating to the left side. Yes, the nerve injury was on the right side. So uvula deviate to left side, opposite to the side of lesion. Then lesion was on the right side. Yes. What else? See, larynx we have discussed. You cannot abduct the vocal cord. So abduction is possible on the normal side, left side, but not on the affected side. So you mean to say vocal cord on the right side will come to paramedian position? Yeah, because you are unable to abduct it, So we are unable to abduct it, so it will be coming in the midline paramedian situation. Yeah, not exactly midline, but it is kind of a cadaveric position if entire vagus nerve was involved. So somewhere near the midline, yes. All those things can be discussed. But again, it is a brief overview. It is just an overview. If it is just an overview, then can we go into details? Yeah, let us start with the details now. See, first you have to start with the vagus accessory complex. What is that? Vagus nerve and cranial part of accessory nerve. What are they doing? Let us see what they are doing. This diagram you have to draw. What is this about? This is about the vagus accessory complex. Yeah, what is it about? Do you remember that C125 spinal cord gave you spinal accessory nerve to enter the cranial cavity, take a U-turn and exit the cranial cavity to supply two muscles there, sternomastoid, trapezius. How this nerve enter and exit the cranial cavity? Spinal accessory nerve entry point is the foramen magnum and exit point is the jugular foramen. For some time it will be inside the cranial cavity and then it will exit the cranial cavity, supply two muscles, namely sternomastoid and trapezius. But that is not our topic of discussion. Our topic of discussion is the other component, which is cranial accessory nerve contributing to nucleus ambiguous. Now when you say cranial accessory nerve contribute to nucleus ambiguous, remember one thing clearly. It is the cranial accessory nerve which is important to supply the muscles of palate, pharynx and larynx. But the fibers are carried by branches of vagus and this is called vagus accessory complex. What is vagus accessory complex? Vagus is working like a vehicle. to carry axons of cranial accessory nerve. So you're telling that vagus is just a vehicle? Yes, to carry the axons of cranial accessory nerve. So vagus is carrying the axons of cranial accessory nerve where? To supply muscles of palate, pharynx and larynx. You mean to say muscles of palate, pharynx, larynx are actually supplied by cranial accessory nerve? Yes. Not the vagus nerve? No. Really? Yes. You're telling muscles of palate, pharynx, larynx are supplied by cranial accessory nerve? Yes. And not the vagus nerve? No. Then what is vagus nerve doing here? Just a vehicle to carry the axons. Okay, but not all the muscles of palate, pharynx, larynx are supplied here, because we had some exceptions like stylopharyngeus develop in the third arch is supplied by glossopharyngeal nerve contributing to nucleus ambiguus. So nucleus ambiguus, glossopharyngeal nerve is contributing to supply muscle of the third arch, which is stylopharyngeus. It is not supplied by vagus accessory complex. Similarly, one muscle of palate is not supplied by vagus accessory complex. Who is that? Tensor palati, you remember, developing in first arch. If it was a tensor palati developing in first arch, who will supply? First arch nerve, mandibular nerve, trigeminal. So tensor palati is supplied by mandibular nerve, trigeminal because it is the muscle of first arch? Yes, otherwise, remember, most of the muscle of palate supplied by cranial accessory nerve and muscles of pharynx supplied by cranial accessory nerve, except stylopharyngeus supplied by the glossopharyngeal nerve. So these are some of the things which we have to memorize. Let us do it. What do you want to do? Remember, most of the palate, pharynx, larynx muscles are supplied by cranial part of accessory nerve, fibers distributed by vagus nerve. It is called vagus accessory complex, with a few exceptions like stylopharyngeus, because stylopharyngeus develop in the third arch already supplied by glossopharyngeal nerve, and tensor palati developing in the first arch, so already supplied by trigeminal mandibular nerve. These are two exceptions. Also one more. What is that? You know, all the muscle of tongue are supplied by 12th nerve except one which is supplied by 11th nerve, and name is palatoglossus. Actually, it is the muscle of palate and tongue. So you are telling all the muscle of tongue supplied by 12th nerve, yes, except palatoglossus, which is also muscle of palate, is supplied by 11th nerve, yes. Which part of 11? Cranial part of 11. So all the tongue muscle by 12, but the palatoglossus is supplied by cranial part of accessory nerve. Yes, that is the point. These are all MCQs. Exceptions become questions. Be careful about exceptions. And now, what will happen if nucleus ambiguus is compromised? If nucleus ambiguus is compromised, then number 9, 10 and cranial part of 11 will be compromised. And what will happen? You know already, difficulty speech swallowing. Why difficulty speech swallowing? Because muscles of palate, pharynx, larynx will be compromised. Remember, nucleus ambiguous on number 9, 10, 11 in the lateral medulla and controlling muscles of palate, pharynx, larynx, developing in arch number 3, 4 and 6. If you say so, what will happen to the uvula? Uvula will be deviating to the opposite side of the lesion. If the lesion is on the right side, uvula will deviate to left side. And what will happen to the vocal cord? Vocal cord on the normal left side are abducting and adducting. Normal vocal cord is abducting and adducting, but not the right side affected vocal cord. Why? What will happen to the affected vocal cord? Muscles are not working, so it is not working. No abduction action, no abduction action. So what is this? Cadaveric position near the midline. Okay, so that is vocal cord has become static. Yes, on the affected side, right side. So these are some of the things which we have to remember. You remember it was damage in the Wallenberg syndrome, lateral medullary ischemia, resulting in difficulty speech swallowing due to paralysis of palate, pharynx, larynx muscle. So in Wallenberg syndrome, these problems will come. Now, once you are through all that information, what I need to discuss is the arch muscles. What is the arch muscles? I'll tell you. This is the table showing arch and corresponding nerve and the respective muscles. Okay, which arch you are talking about? Arch number 3. And which nerve? Glossopharyngeal nerve. And which muscle? One muscle of pharynx, which is called stylopharyngeus. Stylopharyngeus, elevator of the pharynx, stylopharyngeus. Okay, then what about the arch number 4 and 6? As we're talking about arch number 4 and 6, let us discuss branch of vagus here. Which branch? Superior laryngeal nerve, and a few more branches will be there. But one of them is superior laryngeal nerve, branch of vagus for the 4th arch. And what about the 6th arch? It is a branch of vagus called recurrent laryngeal nerve. So telling that for the 4th arch, the nerve is branch of vagus, superior laryngeal nerve, and few more nerves, branch of vagus. Yes. Which branches of vagus? That we don't need to know names. Just tell some branches are there. Means they don't have names. No, they don't have names. Okay. What about the 6th arch nerve? It is recurrent laryngeal nerve. Then can you tell me which muscles developing? Yes, you have to understand. The muscles of palate and pharynx develop mostly in the 4th arch. If you say muscles of palate and pharynx mostly develop in the 4th arch, there are some exceptions, like you have known. One muscle of palate do not develop here. Which muscle of palate? Tensor palatii developing in 1st arch, supplied by mandibular nerve trigeminal, do not develop here. So tensor palatii do not develop here? No, it develop in 1st arch. So otherwise palate muscle develop in 4th arch? Yes, similarly. Pharynx muscle develop in 4th arch mostly, but there was one exception. You already know that, stylopharyngeus. Stylopharyngeus is one muscle of pharynx that is not developing in the 4th arch. Then where is this developing? Stylopharyngeus is one muscle of pharynx developing in 3rd arch, hence supplied by glossopharyngeal nerve. Otherwise, muscles of palate pharynx develop mostly in the 4th arch. And what about the muscle of larynx? They develop in the 6th arch. Now, if you say muscles of larynx develop in the 6th arch, all the muscle of larynx? No. One exception is there. What is the exception? It is cricothyroid muscle, a tensor of vocal cord developing in 4th arch. You're telling almost all the larynx muscle develop in the 6th arch, but except one, which is a tensor of the vocal cord, cricothyroid muscle. Yes, cricothyroid muscle is a tensor of the vocal cord, and that is developing in 4th arch. Hence, it is supplied by a branch of superior laryngeal nerve. Otherwise, the larynx muscles should be supplied by recurrent laryngeal nerve. Understand? Since most of the larynx muscle develop in the 6th arch, they should be supplied by recurrent laryngeal nerve except one muscle, which is cricothyroid muscle, tensor of vocal cord, which is developing in 4th arch, hence supplied by a branch of superior laryngeal nerve. Now, you know, there was a nucleus ambiguous. Yes, it is a number 9, 10, 11. Which part of 11? Cranial part of 11. Okay. This nucleus ambiguous was for speech and swallowing. How? By controlling muscles of palate, pharynx, larynx. You means to say these. Yes, these muscles. So, you are telling that this is, you are mentioning that this is nucleus ambiguous. Yes, the number 9, 10, 11, cranial part of 11. Yes. And controlling muscles of speech and swallowing, which are actually muscles of palate, pharynx, larynx. Now what? Now understand one thing clearly. What? Most of the palate, pharynx, larynx muscles are actually supplied by cranial accessory nerve. You mean to say muscles of palate, pharynx, larynx are supplied by cranial accessory nerve? Yes. Then what is vagus nerve doing? Vagus is doing nothing. It's a vehicle. If vagus is doing nothing, it's a vehicle. What is this vehicle for? To carry fibers of cranial accessory nerve. What is this? This is called vagus accessory complex, controlling the muscles of arch number 4 and 6. You are telling that there is some vagus accessory complex controlling muscles of arch number 4 and 6, means the muscles of the palate, pharynx, larynx. Yes. And mostly supplied by cranial accessory nerve. Yes. And vagus is doing nothing here. No. Just a vehicle to carry the axons of cranial accessory nerve. Yes. I don't understand this. What is happening? I thought that larynx muscles were supplied by recurrent nerve. Yes, of course, but not exactly the recurrent nerve. What does that mean? It means larynx muscles are actually supplied by cranial accessory nerve, but the fibers carried by recurrent laryngeal nerve branch of vagus. You are telling larynx muscles are supplied by cranial accessory nerve. Yes, but the axons carried by recurrent laryngeal nerve branch of vagus. Now, what will happen if I cut the recurrent laryngeal nerve? Then larynx muscle will be paralyzed. Why larynx muscle will be paralyzed? You just told that vagus is not supplying larynx muscle. See, when we cut the recurrent laryngeal nerve, you have also cut the axons of cranial accessory nerve. That is why the larynx muscles were paralyzed. Larynx muscles are actually supplied by cranial accessory nerve, but the fibers were carried by recurrent laryngeal nerve. So when you damage the recurrent laryngeal nerve, you have damaged the cranial accessory nerve fibers. That's why the larynx muscles were paralyzed. Don't say that larynx muscles are supplied by vagus nerve. It is by cranial accessory nerve. Now this is a controversy, because some books will not believe in that. See, most of the authors in India believe in vagus accessory complex, but some of the authors do not believe in vagus accessory complex. But since most of the authors believe in vagus accessory complex, I have discussed that with you. And follow whatever I am telling. Understand, when you cut the recurrent laryngeal nerve, you also cut the fibers of cranial accessory nerve. That's why the larynx muscles are paralyzed. Okay, that will help me to answer some MCQs. Yes, that is the purpose here, isn't it?